hello. Welcome one and all to another episode of WhickTV, across ideological space, where we come together and discuss issues political and cultural, from the silly to the serious. Oh, and we have a show for you today, gang. A show for you today. So, we're going to be talking about government efficiency, social safety nets. We're going to be talking about universal health care. Is it more of a problem than it is a solution? Some people seem to think so. But we're going to get into it. We're going to discuss it. We're going to find out. I want to thank all of my guests for being here. I want to thank all my audience for showing up. Yeah, let's talk about it and let's get into it. I think I'm live on all my ends. Everything seems to be going well. So, okay. Let's start off by introducing ourselves and the topic, and we're going to start with 𝕾𝖎𝖎. Please, go ahead.
Hi, Wick. Thanks for having me. Thanks for hosting this topic. My name's 𝕾𝖎𝖎. I don't really do streaming or anything like that. I'm just here to argue my points. Thank you for having me.
No, thank you. Next up, we have 𝕾𝖎𝖏, please.
Wick, do you want us to introduce like kind of opening statement?
I thought so, but I guess we're just saying hi.
I can do that.
Yeah, 𝕾𝖎𝖏, go ahead.
So my argument's pretty simple. I think all of us here kind of want the same thing, which is for people to have, healthcare coverage, is to get the treatment that they need. I think all of us want that. The question is, what's the best way to do that? And from my experience, I mean, we have a few. I'm not sure about other countries and how they do it. I'm not going to pretend like I understand Canada's healthcare system and how that works. I have obviously anecdotes that their system's kind of inefficient and slow, but I'm not going to make any statements on that. But as far as in the US, we do have programs that are provided by the state. And these programs are outclassed by privately provided plans that are in the same tier. And I think that just goes to show how inefficient the government is at actually implementing programs that will fulfill the needs of people, because most people who are on these state programs are also enrolled in private plans that help fill the gaps left by the state. And I think just pouring more money into these programs is going to be not at much benefit when we also have the private industry that's shouldering the costs of these things. And it would just be a higher burden on the taxpayer at the end of the day.
Okay, well, we'll get into it in the opening and see if people agree with you. 𝕾𝖏𝖏, go ahead.
Yeah, I'm 𝕾𝖏𝖏. You can find me at 𝕾𝖏𝖏 on Twitch, Twitter, and YouTube. My position is pretty straightforward on a fundamental principle. Just simply by virtue of existing does not mean that you are entitled to the labor of other people. People own their own labor. To suggest otherwise is the foundation of slavery. When we're talking about universal healthcare specifically, I think universal healthcare not only asserts that you are entitled to somebody else's labor, but it also is inefficient and shifts costs away from people who use the service towards people who don't use the service. And look forward to getting into it.
Okay, yeah, I'll definitely see if other people share your views here. 𝕾𝖏𝖏, let's find out. Next up, first time guest on my show, 𝕾𝖏𝖏, please.
Yeah, so my stance is kind of just around government efficiency as well. I think I read last year the government wasted $247 billion of taxpayer money. The Pentagon in 2021 or 2022 audit couldn't account for 61% of their assets. And then just this year or last year, I believe it was $220 billion they couldn't account for of money that was paid out to contractors or assets that were given out to contractors. So I don't believe that that the government can efficiently disperse a universal healthcare plan and control healthcare from a government standpoint. They're too inefficient at everything they do.
Just FYI, Killian, you were low. If you could turn up your volume just a tad, people are having trouble hearing you. Apparently, I have you at 200 on my end, so if you could just scooch that notch up, yeah, be helpful. I'm sorry, I didn't mean to interrupt. Are you finished with your statement, or
do I need to say it again, or are we good?
No, you're good.
Right.
I think.
Okay, is that better? Is that better?
It's better, gang. Can you hear him better? I hope so. They say it's a bit better, so maybe just a smidge more, and then we can get there. But now, next, finally, Falsers, please. What's your stance here?
Sure. So I'm Falsers. You can find me on Twitter at Falsers and in the space. I'm not a content creator, but I like to do these panels. I'm going to take just a little longer to lay out my stance since I'm the only one on this side of the fence, and I hope everybody will give me the 2 minutes of patience to just kind of work through it here. Usually when we hear people rally against, what's called socialized healthcare, universal healthcare, it's done so in one of about 3 ways usually. And the first one is a principled argument, which is like a rallying cry against what they're calling socialism or social programs. And it's a point that is cited in spite of the many, many social programs, a lot of which are very successful, that we already have in this nation. The second is an anecdotal argument. And we heard this a little bit, I think, Leon said, in my experience, that's kind of a call to anecdote, a point that is cited to try to zoom in and obscure the larger body of evidence, which overwhelmingly suggests that our system is in dire need of overhaul. Or 3, they'll diminish the data and evidence that is clear or divert away from it. Because to look at this subject in an empirical and analytical way tells a very clear story. We can't be short-sighted or myopic when we look at our position on things like the healthcare system, because it's not a simple subject. It is a complex system that needs well thought out and complex solutions. And so we can't look at it in a really particular way and ignore the other 80%. There's 3 main facets we've got to consider with this healthcare discussion. The first is access to healthcare. Can people get the care that they need? The second is the financial viability of a system and the subsequent economic effects of that. Can people afford it? Is our system financially viable? And what are the economic impacts of our current system? And then the third thing is the quality of the care they're getting. Are we giving care that presents measurably better long-term outcomes for people? And so let's go through those. And this is my position. In terms of access, we're the only high-income country in the world that does not guarantee health care. We have 27.5 million uninsured Americans in our country. Financial viability, that's point 2. That's the other lens we need to look through. We spend more in our GDP, nearly double, and pay more per capita, nearly double again, than comparable countries that guarantee health care. The quality of healthcare, that's that third lens we need to be looking through on this. For what we're spending, you'd think our quality would be higher. We're spending double, but it isn't because our system's not properly regulated. Our life expectancy in the United States is 77 across both genders. Any other country of comparable development and economic status, it's a range between 81 and 85. We are last. We are absolutely last. We have just short of double the rates of chronic disease per capita at 28% versus about 18% for those other countries on average. And we have 265 deaths per 100K capita that are unavoidable from medical miscare compared to 160 on average for similar countries. We are losing.
Okay, and with that, let's get into it, gang. I guess the first question I'd ask you, and I'll direct this at Falsers, but the rest of you, I'm curious what you think as well. Given that, yes, I think all of us could agree that, and again, correct me if I'm wrong, that Americans' healthcare system isn't perfect. The question isn't, is our system good? It's, will this change to socialized or universal healthcare make it better? And I think that that's where the sticking point's going to be here. And I'm curious to see what you all think of that. Like, simply because it works in Canada or it works in other countries, doesn't necessarily mean that adopting that kind of system will work here. What evidence do you have that it will?
A lot of evidence. In fact, we've got South Korea, we've got Canada, we've got France, we've got Germany, Japan, Sweden, Australia, Belgium. There are plenty. And the counterpoints that usually get cited to this is like, well, our quality of healthcare is better, but it's not. The data simply says that it's not. Our long-term outcomes are worse across the board. And you can find like little areas of specialty that we are better in, such as like we're way better in breast cancer outcomes, but we're among the last in cervical cancer outcomes. Those data points do exist, but across the macro spectrum here, we are doing way worse than these countries. And I'm not saying that we need to completely socialize the healthcare system and make it the only option. I think Leon pointed out something very, very astute in his opening argument, which is that almost all of these countries have a private option. And I'm for that. But the difference between them and us is they have a baseline government program provided to everyone that makes sure everyone in that country is 100% insured. Again, we have 27.5 million uninsured in this nation, and it shows in the subsequent data that ripples out from that.
Go ahead, gang. What do you think?
All right, he mentioned me a few times, so I'm gonna go first. Yeah, Falsers, like I said at the beginning, I think all of us want the same thing. Maybe not Lactoid, because he's arguing from a point of principle, which is fine. But the rest of us, we're like, we want people on healthcare, at whatever cost, whether it's universal or I'll speak for me. I would like people on healthcare. I want all those millions of people who are not on healthcare, like myself, I'm not on healthcare right now, to be on healthcare, to have insurance or to have some way to pay for any medical costs. And my argument is that it's the government just at this point cannot handle that because that's not what they've been geared towards. It's not their role. And it's proven through the programs that we already have, like Medicaid. We already have that program for people who are poor that need healthcare, and it's good. That's good coverage, just better than Medicare. But the problem with it is that even those people who are on that, the majority of them have supplemental private as well. So that means there's something lacking. So my argument is that the private industry can cover the costs, can hold the costs of that would be of healthcare, and it would not be put onto the shoulders of taxpayers. Because if we were to have a universal program, I think, with these other programs that have the majority of those people also on supplementary private insurance, I think the same would carry over for them. So it would just be kind of redundant. But I would, of course, agree that the people who are not on health insurance, we need to find a solution for them, for sure.
I'm curious from Lactoid's perspective, because Lactoid kind of is the odd man out here in a way as well. What do you have against government healthcare in general? Like, it seems like you think it's a form of slavery, right? Can you elaborate on that a little bit and kind of justify that? That seems kind of silly on its face.
Well, so we can go into. I have a number of objections and points against a lot of things that Falser said on the kind of the more objective points, the fact-based points. I don't think the data is clear on a lot of this stuff. But as to the specifically the principal question of what is the basis for slavery? So I understand that's like an incendiary term, but the reason I use it is because I think it's one of the best terms to describe any kind of forced service or forced labor. So I mean, the line of thought, the train of thought is very simple. So the concept of universal healthcare, or really any kind of nationalized service, and so I will apply this to all social services, by the way, in the broader conversation, is okay, by virtue of existing, by the fact that you happen to have been born and you exist, you have a right to this service, right? And a service is more than just a thing. A service has to be provided by somebody, right? That is labor. Somebody has their own labor and they are providing it out. So the question is, well, if you're saying I have a right to universal health care, well, that must mean that I have a right to force the doctors to work for me, even if they don't want to serve me.
Well, let me ask you this, Lactoid. So you are a doctor. You have the expertise and the tools to do your job and do it well. Man has a heart attack right in front of you on the street, right? Do you have no obligation to help him?
I do not think that you have an obligation to help people. No.
Really?
I think that in the same way that I shouldn't have an obligation to provide my services to people, and a farmer shouldn't have to like grow food for somebody, right? Nobody should be obligated to provide a service for somebody else by virtue of them existing. And the reality is that when you have like the government paying for it, when you have the expropriation of people's labor and the redistribution to people who didn't contract for it, you have forced labor. You have to, because we're not getting these services out of thin air. Somebody has to be providing them.
Any thoughts on this, gang? Like, come on, gang, get into it.
I mean, I did want to take up something he said. So
please
you
go
did
ahead.
You did mention breast cancer. So I think the stats were 81% of breast cancer patients in the United Kingdom, which is supposedly a great NHS. 5 years after 5 years, only 81% of breast cancer patients live at least 5 years after their diagnosis, and it's 89% in the United States. And then for Prostate cancer, it's 83% versus 97% live after 5 years. Also, in Britain, in the United Kingdom, you wait 25% longer for cancer treatment than you would in the United States.
I love it. I love the data. I'd love to talk about the data for a moment.
We will. And also, I mean, I got all kinds of data just like you do, but
Go
some
ahead.
of that contradicts what you said, right? I guess my biggest
I
concern.
specifically stated that we are ahead in breast cancer.
Well, you did say breast cancer, but you didn't mention prostate cancer or how long you have to wait for cancer treatments. And I'm sure
I'm not
if
going
I
to mention every
look
field.
further, well.
Right. So what I specifically said is we're doing better in some areas and not in others. And what you're going to hear in this panel is people drilling into really myopic data points and not looking at the macro, which is exactly what you're doing now.
Right. I mean, we have to have some sort of data set to go off of, right?
Yeah, I love that. I love that.
So yeah.
Okay.
Well, we could also talk about how long you have to wait, how much longer you have to wait. Sometimes you have to wait 7 to 8 months just for non-elective surgery. And when people have to wait that long, that affects their job, their mental health, a myriad of things, right? Sometimes it gets them addicted to painkillers because they have to be prescribed more medication for pain. That is the inefficiency I'm talking about when you're talking about a government-run healthcare program.
Love it.
I also think that people should have access to healthcare, right? Especially low-income families that deserve it. So
that deserve it. Wait. Low-income families that deserve it. Which families don't deserve health care?
Well, if you're a 30-year-old unemployed 3-pack-a-day smoker, I don't think you should have free health care. I don't think I should have to pay for your lifestyle. So it would need to be people that are trying to be gainfully employed, are healthy, maybe even drug tested. If I'm going to give my money to somebody else, they need to prove that they are trying to better themselves, in my opinion. You can't just hand out money to everybody.
Leontes, I'm curious, do you share this opinion?
I think it depends how you handle it on a policy level.
How would you handle which families get healthcare and which families don't deserve it at all?
I think, well, if I were taking the stance that everybody should just have healthcare as a right, which I don't necessarily hold that position. But if I were taking that stance, it would probably be in the way that some of the other countries that offer it have, which is higher taxes on specific items. Because one of the things about healthcare that's really important is preventative care. That's something that really, really needs to be emphasized when it comes to costs, because preventing illnesses before they happen will keep costs down for everybody. So I like I said at the beginning, I don't know specifically how these countries do it, but I do know that countries like France impose taxes on like unhealthy stuff, higher taxes on like smoking, things of that sort, and some of that goes to supplement their healthcare systems. So if I were to take that approach of everyone should have it, that would probably be the way it would be rolled out, is put higher taxes on things that have an effect on health.
I would love to address that in Killian's point. Hold on real quick. I don't want to get too far from what Killian's point was. So the data, I want to reiterate that I said they're going to drill in on really specific things we do better. And we do some things better. Absolutely. But we do most of it worse. So real quick, you can see my background here. Wick, if you want to make that bigger, you're welcome to, for the chat or for whoever. This is GDP per capita and health consumption spending per capita. So what you're going to see here is both our health spending at a personal level and our GDP allocation are really high. There's an outlier. That green dot is the outlier. That's the United States right there. So when we have these conversations about can we do it? Well, absolutely we can. Absolutely we can. We're among the highest spenders in the world. Let's go on to one more slide here. If I can get
How many slides you got, buddy?
2.
Okay.
2. Because that's something you'll let me do.
Yeah, of course. After your go ahead. If you got your other slide ready, we can't see.
Yeah. Okay, so we've got these claims on here that they're just assertions with very little backing, which is like, oh, the USA is amongst the top in the world. We're not. Here's your top 8 right here. It's actually a top 10, but Discord won't let me get it in there. The USA is not in the top 10. Do you know where we are? You know where we are? We're 30. We're 30. Do you know what these countries that are leading this list?
Yeah, can you give us some context?
Just real quick. Back to the first one.
Can you give us some context? What like metrics?
Absolutely. This is data from the WHO. This is data from the WHO, And what you have here is a healthcare index score, and it takes into account a ton of different metrics, and then they give it kind of an aggregate score, and you can see some of the little breakouts that they're tracking beyond that there. But effectively, what you notice here is all of these nations that are ahead of us here in this top 10, they have some form of socialized healthcare, some form of universal healthcare. They're 100% covered, right? And there
Yeah.
are nations that do a free market model, but they do it a little better than us, that are more successful. But for the most part, every single nation in the top of the world standard for healthcare, they're using universal healthcare. And so when we make these assertions, Killian, like, hey, our healthcare is way better, we need to be able to see that on the macro level. And what does that look like? I can turn off this slide here. I'm done with my slides for now. What that looks like is your life expectancy, right? Life expectancy would be a major contributing factor, but our life expectancy is lower. And you may say, well, we have some cultural things here. We have gun violence.
Exactly.
We have diabetes and obesity.
We have
Well,
horrible.
great,
We're
but there's
unhealthy.
still a problem. There's still a problem in the other long-term macro metrics here. We still have problems with prices of prescription drugs across our nation. We're almost double the other comparable nations. We have
So
problems
cap is
with our
40% profit.
health insurance access as far as like the number of people that are actually insured. Like it goes on and on and on. There isn't a big macro that you can look at with this data where we're leading the charge. There simply isn't.
I think we're unhealthy due to culture, not healthcare.
But I can't have a
culture.
healthcare conversation with you about culture. I want to have it about healthcare.
Well, I mean, we are an unhealthy nation. I mean, it's proven out time and time and again. And I simply don't believe it's. I
Do
believe
you
that's
think
lifestyle.
pharmaceutical
I think
companies
it's
have double
lifestyle.
the
Hey,
profits?
let me finish.
Yeah,
I think
sure.
it's lifestyle more than the actual healthcare system. And I do agree, pharmaceutical companies are charging too much, but you can cap that at 40 or 50% profit, right? We
Sure,
could
I
probably
love
do that. I'd be okay with that, right?
Yeah.
I mean, a business, they're in business to make money, and they need to be able to have a pretty hefty profit in order to do research and development and develop more medications for us, right? So they have to have some sort of profit margin to be able to continue their work. Yeah, respond.
No worries.
Go ahead. Just real quick. I know Lactoid wanted it. He had a few
Was it-
disagreements. Go
I have a
ahead.
few disagreements, Falsers, but was there a specific point there that you wanted to disagree with, or can I?
No, I was just going to add a very quick addendum that any of the data that I'm citing tonight is coming from either the WHO, the Peter G. Peterson Foundation, which is the centrist organization, or the actual like World Bank that the UN uses for data aggregation.
Gotcha. So when you said before, I'm here to discuss healthcare, not to discuss culture. One of the issues is that the health index that you're pointing to, a significant portion of that metric that you're using to demonstrate that the U.S. is more unhealthy, one of the metrics here is health-related behaviors and personal circumstances. This is one of the primary issues when it comes to cross-country comparisons. Generally speaking, cross-country comparisons aren't good, like for most things, but for this is no exception, right? There's plenty of reasons why cross-country comparisons are going to be an issue here. One of which was already pointed out. Americans tend to be less healthy in terms of obesity, in terms of drug consumption rate. Americans consume more drugs than I'm pretty sure anywhere else in the world. Life expectancy is 77, but most of that drop came after the fentanyl epidemic and the drug epidemic and the opioid epidemic. And that combined with obesity and combined with alcohol consumption could have something to do also with the rates of chronic disease. Now, there's a whole bunch of reason. And by the way, when you look at those specific metrics that you were talking about, if you wanted to get into like the nitty gritty about the specific points, it's really not clear why any country ranks above another country when it comes to like success rates in treating certain cancers. Yes, America is near the top in some. Yes, they're not near the top in others. But even among other countries that do have universal healthcare, they also seem to indicate the same sort of randomness when it comes to where they wind up in the cancer treatment categories depending on cancer. So I somewhat reject cross-country comparisons here as being definitive. I'm more interested to see what would an American universal healthcare look like. And one of the statements made as well, it's just obvious what this is going to look like. It's going to save us money. But this data is not clear. There are economists and there are institutions that have reviewed this, and American Medical Association is one of them that is not in favor of universal healthcare for one of these reasons.
I wonder why.
Which sure you can say that they're biased or whatever. I mean, there's plenty of economists as well that challenge the efficacy of universal healthcare. Kenneth E. Thorpe from Emory found that if implemented, if the current universal healthcare programs proposed were implemented, about 2/3 of American households would be paying more overall. Even the overall tax burden on them would be significantly more.
Actually, can we pause for a second, because we're getting really far from your very first point, and I want to get to that before the other three come out, so I can remember them. Just to be honest with you. So your first point was on lifestyles, the fentanyl epidemic, all these factors that ripple out as a person lives that might be variables that impact the age at which they pass away in terms of life expectancy. Is that a fair characterization of what you were talking about?
So life expectancy takes into account like a whole bunch of different things, but if you
Right.
have people dying young of like opioid overdoses, that's going to really cut down the life expectancy.
Right. So we're saying the same thing here. That's fine. So then we need to agree that there might be some other data points we should point at to measure these things other than life expectancy. And I think that's great. So let's talk about infant mortality. And usually when infant mortality comes up, the rebuttal you get is like, well, the countries count them differently, which is precisely why I decided to use data from the WHO, which did the study with a consistent counting method across all countries. And what we find with infant mortality is we're nearly double the rates of other countries as of 2016. And it's only trending upward in the other data I could find as far as the gap between the two. So when I talk about other countries, just for a point of clarity, as I say comparable countries, what do I mean by that? I mean countries of similar economic development and status and similar infrastructure development.
Just for clarification, for my clarification, because I'm not terribly familiar with infant mortality as a topic, but is the argument that you're making, Falsers, just to be clear, that in America, because of lack of access to healthcare, we have a higher infant mortality rate? Is this connection that you're drawing?
That's part of it. Yep. So it goes back to the three pillars I built my position upon. Access is one. You're going to have less people going into the healthcare system on the basis of access, just at face value, right? And then the financial component is the second part of that. And that's tied to the first one. So if I am sick and, I'm not super concerned at the moment, I'm less likely to go to a doctor if I know a big bill is coming before I have serious conditions. And we see the ripple effects of those outcomes. And then the third thing that we talked about was the long-term outcomes. So that goes into some of the macro data. But again, our infant mortality rate is nearly double comparable countries on these issues. And so when we talk about the quality, I'm making a qualitative argument against our healthcare system right now. When we talk about the quality of our healthcare system, it simply does not follow the numbers at scale. And again, Killian, you're very astute. I would do this too if I was on your side of the aisle, to point out there are things we do really well. But in the grand scheme of things, we simply are not serving our citizens on a qualitative basis when all the ingredients are.
Kara, Lactoid, a couple of things. I want to get Leontes in here too, but Lactoid, finish your back and forth, and then I want to see if Leontes. I have a couple questions for him as well.
Great.
So.
I wanted to quickly address this as well, and this is another opportunity to demonstrate why cross-country comparisons are difficult. So in the United States, 98.4% of all births are done in a hospital. We're only less than 1% are born at home, and even less than that are born in any other form of birthing center. The vast majority of babies in the United States are born in a hospital, and this number is relatively comparable compared to all other countries in the OECD average. Now, what are other things that we know contribute to a high infant mortality rate? Obesity and drug use. Wow, two metrics that once again the US leads the world in. That we do have an issue with lifestyle. I do not deny this. But this idea of access, that the reason why is because women aren't able to access hospitals, just does not seem to be empirically borne out in the data. Once again, this is why I think cross-country comparisons are an issue, and why I'm interested in as to the actual analyses of what would happen in the US if universal health care was implemented. There, like I pointed out, there are economists that find, and I find this relatively credible, you might disagree, roughly 2/3 of American households will see an increase overall in expenditure. How is this the case? Well, the reason is in America, only 5% of people use up about 50% of all healthcare costs. 50%.
Quickly, though. Given that, even if that's true, and I'll accede to you that it is, that the healthcare costs will rise. If it is coupled with a rise also in qualitativeness of care, is that not worth it to some? Is that not a fair trade-off? Saying, well, yeah, we'll pay more, but more people will have access.
It's not a real trade-off. at all. It's not even a real trade-off is the
But
problem.
do you understand what I'm saying here though? Like if
I understand the question.
cost, right? Cost rises, but also quality rises, then what's the issue?
But we already spend double of like every comparable country in the world. This is nonsense. So a lot of times these economic studies are framed in the sense that like it's the system we have and then we build a socialized system on top of it, which is a really disingenuous way to frame it in the first place. We spend double per capita what countries that are already doing this are doing. And I love the economic discussion as well, because we have a serious issue in our healthcare industry with regulation. And you see it left and right. You see it in the macro scale at pharmaceutical profits. You see it with insurance profits. But there are some really good case studies for this too. You can look at the fact that in November of 2018, Aetna Insurance, which is one of our biggest providers, was purchased by CVS, a pharmaceutical provider. And prior to 2018, the quarter-over-quarter economic growth for CVS's pharmaceutical branch was about 10-ish%. It exploded in the next 9 months to over 100% for the first time in that company's recent history. And then it went on for the next 2 years to do 100% again, and then the next year. And so the reason for that is because when the healthcare insurance company has no regulation over it, and they are able to buy the pharmaceutical company has no regulation, and they're able to buy the insurance company, they're able to price fix and have preferential treatment towards those brand names. On the economic scale, we look at something like insulin, where Eli Lilly had a over 5,000% markup on their manufacturer prices, and it only took the threat of a standardized insulin price, an insulin price cap from the Biden administration, and they brought it down to like under, God, I forget what it was, but it's like $30 now or something. They brought it down under $100. I forget the exact numbers, but they brought it down significantly. It was like a 70% price cut they did to it. So the economics are not an issue here. The regulation is an issue here.
Well, you make a great case for reforms on the pharmaceutical companies, right? I agree with that. Yep. I think they do need some sort of reform, and I think they do need some sort of regulation. But that's still not the case for national health care. That's what we're talking about. We're not talking about.
Hold on, they're one and the same, Killian. I want you to understand what I'm saying. The pharmaceutical companies are buying the healthcare insurance companies.
So
I want you to understand that.
You want them to take over pharmaceutical research and development and all that as well?
Well, they already do. Every pharmaceutical advancement we've made in the past 20 years has been taxpayer funded. So that's not an if, that's an am.
Yeah, but you want them to run the business, right? You want them to run the pharmaceutical company?
You need to understand the regulation, and my position on this specific thing is that the regulations should be such that pharmaceutical companies cannot own health insurance companies. That's a very clear thing to me that we need to do. But the fact of the matter is, having a system in place where there is a government product that covers everyone at a baseline is a good thing. And anybody that's pro-free market should love that, because it's a very anti-monopoly practice. And remember, I'm not anti having a private option. I think the private option is great. The number one healthcare system in the world in terms of the macro metrics is South Korea, and they have a private option. And that private option is incredibly popular, by the way. It's just the fact that they have a universal healthcare option too, supporting it, that makes it so successful.
The South Korean government, I think, is probably way more efficient than our federal government. Like, I think you could look at their infrastructure, take streets, roads, trains, all of that is significantly better than what we have in the United States.
$5.
So my whole contention. Huh?
Well, no, $5 from 𝕾𝖎𝖎. Sorry, I got to make my money, right?
That's okay.
About private industry.
$5. WhickTV needs to pay his health bill.
True.
Come on.
$5 from 𝕾𝖎𝖎 to say, worrying about how billion-dollar companies and trillion-dollar government can save money by not providing adequate insurance is the most America-brained argument ever. And gang, we're coming up on the end of the month here, so if you guys want to contribute and you're on Twitch side, gift those subs, gift those bits, get my money up, gang. And if you on the super chat side, on the YouTube side, like, subscribe, throw me some super chats. I'll try to get them in there. But finish your thought, please.
I'll give some. I'll give some when I'll give some afterwards, Vic. Okay. I'll get you take care of. What was I talking about? What I was talking about was government inefficiency is the biggest thing for me, right? I don't think they can efficiently run a national healthcare system. They've proven time and time and again how efficient they are with our taxpayer money. Me personally, I paid 6 figures in taxes for 2022. I don't want to be taxed anymore. right? It's absolutely ridiculous.
We don't have to though.
And I think I do. I think they're going to raise taxes.
No, again, we
Yes.
have
They
double
are.
the amount of spending already. If these systems are regulated properly, there is simply no need to raise taxes. In fact, if you look at the amount of taxes that these big healthcare companies receive, it's already fucking obscene. There are primary insurance companies where like 70% of their funding is right now tax money. So you're already paying them, just so you know, with your tax money, and then they're charging you so-called free market prices on top of it because we don't have regulation in place to stop that. My position is that if you take that tax money, you enter into an agreement that you do not need to charge us full price as citizens for those services. It's absurd they're allowed to do that. And it really skews the economic picture in such a way that makes it look like what you guys are describing. Like, oh, well, we can't pay for them. Of course we can. We just need to regulate the companies that are R-wording the consumer left.
I would bet the farm that if they pass universal health care, they will raise our taxes. Period. I don't, you're delusional if you don't think that's going to happen. They are going, and especially on, higher income earners, which I understand that part, right? I've been fortunate enough, but you know what? I worked myself up we were dirt poor when I was young. So, but the issue is the federal government cannot sufficiently run a national healthcare program. They can't run the military correctly. Our infrastructure is terrible. Our bridges, our roads are absolutely awful. Somehow we don't have our train system, right? I mean, go to any other country. Travel to South Korea. Travel to Europe.
Just real quick, Killian. What do you mean we can't run the military efficiently? We are the strongest military in the world. We're like fucking number one.
Military spending.
They don't know where
I agree with
the
them.
money is. They don't know where the money is.
Yeah. So, Killian, here's the problem, though. I'm not here to advocate for a specific politician
hang on,
or even a specific party instituting these policies, right? I'm here to advocate for a system that I think would be effective. And then it becomes the responsibility of the people in the government to figure out how to make that work. Now, if you want to have a conversation about how we can make it work mechanically and legislatively and all those things, we can do that too. But I'm here to advocate for the best system, not necessarily the competence level.
The best system to me is that the best system.
No, finish your thought, but then I have a couple things. Go ahead.
The best system to me is that we give subsidized. We've proven we can give out money, right, during COVID, right? We passed out checks all over the place, right? Mm-hmm. So what I think the proper way to do this is that people that are low income, underneath a certain income, and are also trying to better themselves, they don't smoke 3 packs of cigarettes a day and shoot heroin, right? Should be able to apply and get a subsidy from the government to pay for monthly health insurance. But I think they should be paying for private health insurance.
But to be clear, only if they deserve it.
Only if they deserve it.
Only if they deserve it, which is
interesting
sticking point. $5 from 𝕵𝖎𝖎 to say, Killian, your taxes will be raised, but you'll be able to get more out of your health care. You spend more, but get much more in return.
It simply isn't true that we need to raise taxes. Again, you look at the number one healthcare system in the world by the macro.
Whether it's needed or not,
I understand. We got to get more people in here, though.
South Korea only has about 5% tax rate for their healthcare system, and half of that is burdened by the employer. It's 2.5% to the employee. The United States, we're at 17% of our taxes and our GDP goes to our healthcare system right now.
I want to give more people.
We need to streamline and make the spending.
I want to give more people some space here. Leontes, I'll pass it to you first, and then we'll pass it to 𝕾𝖎𝖙, and I'm sure you both will be addressed in some of these. Go ahead.
Yeah, so we're talking about a lot of different countries and stats, and I appreciate all that, but I would like to, if you do talk about these other countries and how their systems work, you cannot ignore the lifestyle, the other factors that go into. You just can't. And you yourself also said you don't want to go there, and I agree. Let's not go there. Let's focus on the United States, what we can do in the United States to provide healthcare to us in the way that we need it and the plans that would best fit our needs. And looking at the United States, like I've said, my argument is that, yes, if we could provide quality, competitive health insurance to every American, let's do it. But we can't. because we have programs that are set out to do that, and they can't. To be honest, Medicare, not that great. That's why most people who are on Medicare have supplementary private insurance.
So I appreciate that you're taking that tact on it, but I don't agree that we shouldn't talk about these things. That's not my position. I want to be clear on that. We absolutely can talk about these things. My problem with these things is they're a smokescreen. So like in the big picture, I want you to imagine like all the data sets are like a wheel, right? And the wheel has different spokes coming into a center point. And unfortunately, all these spokes on the macro level are kind of telling the same story. And so like you can say maybe lifestyle and validate 1, 2, 3, 4 of them. But when we're talking about all these metrics collectively, that's a hard sell for me. But let's grant it. Let's grant that. I just want to grant it to you outright, even though I don't for the sake of the discussion. Let's say the lifestyle is a huge problem. Well, we're still back to needing some socialized healthcare and some regulation, because the lifestyles we have don't really impact the prescription drug costs in terms of like manufacturing profit margin. And we are paying more than double the average cost of prescription drugs. It's on average $963 versus $466 in comparable countries.
Sorry, Foster, but
hold on. It's relevant to what he's saying. It's relevant to what he's saying. He's not arguing a specific point, but it's relevant because that's not impacted by lifestyle, right? This is impacted by the fact that healthcare insurance companies and pharmaceutical companies operating in the name of the free market have run all over our nation and put our healthcare system in the gutter. The fact is, in the 80s, when this started, Reagan deregulated our system in the 80s, and we saw our GDP move to more than double in terms of allocation spending over the next 10 years, and it has since almost quadrupled since the 1980s, since we deregulated. And healthcare satisfaction amongst our citizens is far worse than it was then. Healthcare quality is far worse, and we're seeing negative trends. And the positive trends we are seeing are moving at slower rates compared to other countries of similar to.
Lacto, do you agree that the pharmaceutical companies make too much money? They charge too much?
So, no. This is one of the issues, again, with cross-country comparisons, where, yeah, well, look, the United States, the pharma costs are very high. Well, also look at the fact that, again, if we want to do cross-country comparisons, which are not perfect, the U.S. also has the highest medical innovation in the world, including for pharmaceutical drugs. The United States manufactures, develops, and invents far more pharmaceutical drugs than any other country. Why is that?
Funded too.
So, look, a huge part of the money that they get for R&D comes from the fact that they are able to bring in profits, right? There is like a market effect here. Now, I don't know the exact split. I'll be honest with you. I don't know the exact split of what taxpayer dollars are going to the pharma companies. If that is happening, then no, I think that they should use the profits that they make to do R&D without taxpayer money. But nationalizing it sure doesn't seem like the solution to reducing taxpayer money involvement. That would just seem to make it at 100% taxpayer funded, correct?
So they will raise taxes. They will.
Let's walk through it.
100%.
Let's walk through it, because again, I'm for the private option on this, so it's not 100% taxpayer funded. But when you say pharmaceutical companies don't have these crazy profit margins, I want to take you back to one of my earlier points. Eli Lilly had a over 5,000% markup on insulin that evaporated in like a week. They were able to make a 70% cut to their rate on a whim and still be incredibly profitable. Do you think that's problematic, or do you think that over 5,000% margin they were getting is appropriate to the rising epidemic of diabetes we have?
I think when you so it's interesting how you are concerned with taking like snapshot examples, but this is an example where like you are doing the same. You're taking a snapshot example of Eli Lilly.
I love that you called me out of that. Let's zoom out on it.
Sure. Zoom out. Sure. I would like to zoom out. Now, one of the reasons why I think that's, we look at the whole picture is how many of these fucking, pharmaceutical companies fail. How many of their drugs fail? I mean, if you know anything about like pharma investing, it's one of the most risky investing in the planet, and it's one of the most engaged in because there's a massive opportunity for returns, and that's why there is so much money being funneled into the pharmaceutical industry, and why we have the number one innovation rate in the world. But then, yes, like when there is a success, you have to have like a large amount of return Otherwise, no one's gonna fucking invest because the vast majority of the time,
I want to
doesn't
ask
know
about
work.
this. So
Hold
two
on,
things
that
first
problem didn't exist.
before you respond.
Yep.
Two things first. $10 from Temperance Quill to say it seems that most of the panel is against federal health care, but what about taking it down to the local level, having each town, city, county, whatever, instituting a state or community or citywide kind of owned health care?
Yeah,
What do we think about that?
I love that.
Love
Yeah, I
that? What do we think?
Yeah.
No?
I had an employee
Mhm.
that I did this for on a local level, right? He was going through some problems, some alcohol problems, right?
Okay.
Didn't have health care. And he needed to go to rehab. So I was able to, this is on the local level, and I would do this, right? I think it would be much better. I was able to pay for his rehab. I was able to help his family pay their bills, right? For almost a year while he got back on his feet. I paid for their health insurance for a year. Now he's got a $30 an hour job working for the railroad, right? That's the kind of thing, if you do it locally, like I would like to keep more of my money.
Sure,
rather than
if he
send it to the
deserves
government's
it,
going to spend
right?
it wrong. That's right.
Okay.
You seem to have a problem with that. You don't agree with that.
I don't like that phrasing. I really don't. But I'm not on the panel. I'll engage with you later. But I want to. So Lactoid, you were shaking your head, right? You were saying no, that's not okay. Why? Why would a town or a community getting together and deciding to kind of pool their resources to pay for everyone's
great
healthcare
idea.
be bad?
So I guess we don't have the empirics on what that would look like. So I would be opposed to it on like a principled basis of this should be something that, like with all other forms of labor, is privately and consensually negotiated for. I don't think.
Well, I love how the
Let me
data
clarify.
matters.
Let me
for that,
clarify.
but
Let me
not for the
clarify.
other
Let me
things.
clarify.
Hold on. I don't want to get too far from what Lactoid said. Because he touched on pharmaceutical companies real quick.
Real quick, $5 from Time Watch to say just voting my wallet for more panels on topics like this. Okay, fair enough.
I need to say one more thing though. That I've been dying to make a point. So after the pharma point discussion, I just need to say one more thing.
Yeah. So you laid out an argument that these pharmaceutical companies need these margins to get investors, but it's just fundamentally not true. If you look at the pharmaceutical companies, generic drugs make up 92% of the drugs distributed, but they only account for 16% of the total cost going into the pharmaceutical economy. Whereas the brand name drugs are 8% of the distributed drugs, and they're making up for 84% of the cost. And these generic companies are perfectly profitable. They're big businesses with tons of employees. And so it's just
they're not making those profit margins though on the generics.
Obviously, they're not making the same margins, but they're making
not anywhere close.
Obviously, if the margin is 5,000%, it's not anywhere close. That's the point. It doesn't need to be anywhere close, and they're still able to get investors. They're still able to build a business off of it.
No,
your entire argument hinges upon letting them have the world's highest profit margins at the expense of our citizens that have double the actual cost for prescription.
So generics don't take R&D because they're generics, right? The reason why the brand names are going to command such a higher price is because
you don't think generics do R&D.
No, generics aren't R&D. They're generics, right? They're not like brand new research. They're usually older drugs.
I understand, but those companies still do R&D. You understand that, right?
I understand the companies that own generics do R&D, but they're not doing R&D on those generics. They're doing R&D on some new drug.
On that specific thing, but the point
of course, they're doing on the new drug that's going to be at a markup.
If they're all doing R&D, right? It doesn't really matter if it's for that specific drug or not. They're all doing
because that's the percent. The massive percentage profits that you're looking at, those are going to be on the new R&D. That's going to be on the brand name drugs that are on the forefront that are contributing to the United States having the #1 medical innovation rate in the world.
All these companies are doing R&D, and it's specific companies across all their drugs, these big brand names. It's not like one drug. It's across all of them amongst a few companies that are ratcheting up these margins. And we don't see a correlation in the amount of R&D that they're doing to justify the marginal difference. It's simply not.
Why are you saying, like, do you know that for a fact? I mean, we live in the United, like I said before, the United States, if we want to do the cross-country comparison, #1 medical innovation rate in the world.
States. Yeah. So
#1 medical innovation rate in the world.
Without getting too detailed about my own life, because we're on the internet and there's an audience. I work in an industry where we deal with insurance carriers, we deal with general agencies, we deal with brokers, we deal with healthcare, we deal with hospitals, we deal with all those things. So yes, I'm deeply in it every day with work, and I can absolutely tell you that their profits have exploded in a way that is not on the same trajectory as their research contributions.
Okay, so I mean, I guess that's an unfalsifiable point. If we don't want to get into it, that's fair. I'm also work with these organizations and these people. I think it's a lot more complex than you're putting forward.
Hold on. Do
So
you think that CVS Pharmaceuticals
I just
expanded their R&D budget by over 500% in a year?
so there's again another. That's not what that means, right? Again, another hyper-specific point, but that's not what the point I'm trying to make. What the point I'm trying to make is that one of the reasons why there's such an increase in investment in brand names is because, like, whether or not the drug is going to work is kind of a crapshoot. It is, right? And this is why farm investing is one of the most risky investing you can do, like in stock investing, because there's a great chance that your investment's going to flop. And if it happens to work, if they happen to come out with a new drug, it's going to soar. And that's what leads so much money to be pushed into the pharmaceutical industry to begin with. And one of the reasons why, again, we have such a high medical innovation
Let me
rate.
ask.
Now, one thing. I just
Oh,
want to say
the
one thing
dying point. Go ahead. Get the dying point. Go ahead.
Thank you so much. Okay, so one of the points, and when I pointed out that, like, several economic analysis stated that more people, 2/3 of Americans, would be paying more overall, and this was just repeated. Well, we actually, on average, pay the most. Well, so again, in the United States, 5% of the population makes up 50% of all healthcare spending. Right? There absolutely is, like, the bottom rung of unhealthy people, whether through genetic reasons or for lifestyle reasons, especially when you look at the obesity rate, they eat up a tremendous amount of spending. So when it's not, you can't point to the average healthcare spending as evidence that most Americans are not going to actually pay more. People who back universal healthcare, even Bernie Sanders, has admitted, yes, we will have to raise taxes. The only debate is whether or not the tax increase is actually going to be more than the savings from insurance premiums and copays. That's the only real question at play.
I don't agree with that framing.
Okay, well, so you disagree with Bernie Sanders and Elizabeth Warren then? Okay, sure, you disagree. Okay, fine. But what the economic analysis that I've seen indicate that for most Americans, for 2/3 of Americans, if universal healthcare is implemented, they are going to be paying more overall. They're going to be having less money in their pocket. And the people who use up most of the healthcare are going to be paying a whole fuck ton less.
So,
Okay.
Lactoid, while
Before
I
you
disagree
respond, $5 from 𝕵𝖎𝖎𝖙. At Lactoid, why are you defending these companies? They are not living on the edge financially. They can afford R&D 50 times over from one successful drug.
No, people have this, like, bizarre idea of, like, capitalism where, like, I'm a little guy and all these companies, they're like controlling the world. They're all these massive, they can't be touched. It's like, no, like, companies go under all the time, especially pharma companies. They take hits all the fucking time. It's difficult. And then let's talk about, like, Pfizer, like the giant fucking companies that, like, roll out these massive, like, nationwide drugs. They're probably doing okay.
I agree with you on most things, Lactoid, but have you looked at a balance sheet of a pharmaceutical company, a successful pharmaceutical company?
Yeah,
Like
A successful one or an unsuccessful one?
A successful one. Have you looked at their balance sheet?
I'm sure the successful ones probably have a pretty good balance sheet.
But go look at CVS.
Yeah.
Killian's absolutely right here. Go
I
look
mean,
at the CVS example. Go ahead, Killian. I didn't mean to cut you off.
Yeah, I mean,
Are they making new drugs? Are the successful ones making a whole bunch of new drugs?
they are.
Interesting.
They are.
This
Interesting how that
is
works.
okay, stop. This is survivorship bias. Of course the successful ones have good balance sheets and are making good drugs. But
That's
what the
my
thing
point.
is the unsuccessful ones, like, how I would want to know, and I don't know if any of you have this stats, how many pharmaceuticals go under? What is the percentage of failed companies? That's what I want to see.
Well,
Because if only
successful
1% of
pharmaceutical-
pharmaceutical companies actually succeed, then that's a factor, right? Like,
Over
Look,
90%, over 90% of clinical drug development fails.
That's almost every industry. Like, startups fail everywhere. That's not.
Look at
Oh,
the
this
balance
is
sheet. You have to look
significantly
at the
this is
balance sheet.
significantly
No,
higher. This is
absolutely
significantly
not.
higher
It's
in
the same
other
in the
industries.
fucking tech industry. It's
Look at
the
their
same in,
P&L
like,
and a balance
people
sheet.
go
You can
into
see how well
real
they're
estate.
doing.
Anyway, so, like, look, if you look at the companies that aren't, like, radically successful, as you're putting it, as far as, like, developing drugs, but they're still successful, they don't have to have these margins. You can run a successful pharmaceutical company without a 5,000% margin on your medication. That's obscene. But let's zoom out again, because while I disagree with all Lactoid's points, my bigger point here is we need to look at things in totality. Not just the pharmaceutical companies, it's the healthcare companies too. You want to worry about research and development? Great. We do a lot of that in our hospitals. We do a lot of that in, like, the setting in those spaces for grants for research and with grants for research and development. And unfortunately, insurance companies are also destroying our hospital budgets too. Insurance profits for during the COVID epidemic went way the fuck right? And they were going up before in a really sharp way too. So Cigna, our biggest insurance company in this country, saw a 70% bump during the COVID epidemic. United Healthcare, almost 30%. Molina, 60%. Hospitals were moving in the opposite direction because what was happening is these insurance companies are raising all these premiums, and people are going in for legitimate reasons. Then the insurance companies, because they're not regulated, they are denying legitimate claims. Hospitals are now stuck with the fucking bill. That money's got to come from somewhere. So they're not able to attribute as much as their budget to like research and development. Everyone says that they care about the qualitative healthcare in this nation and finding solutions. But the clear thing that all the data points to, both in our country and outside of our country, you guys don't want to do it. And it blows my mind.
Okay, $10 from 𝕾𝖍𝖎𝖙, who is single-handedly funding my YouTube side, and I thank you for it. Like, gang, this is how you put your money where your mouth is. If you like this content, if you like these topics, you got to keep giving me money. 𝕾𝖍𝖎𝖙 is a hero, and we love him. And he's saying, at Lactoid, if pharma companies were going under all the time to develop new drugs, we wouldn't have new drugs at all. The cost of developing a new drug is way less than the profit you get, including failed drugs as well. That's what he is saying.
All I have to do is look at a balance sheet and a profit P&L statement. That's all you have to do. And you can see what kind of margins they have. That the P&L includes research and development. So
why are you dictating why are you dictating what a successful company gets to make?
Because there's human life at stake. That's the answer to that. Because there are lives directly connected to these margins.
Thank you for the 100 bits.
And the availability and access to healthcare is a direct ripple down effect of that.
So if
Do you
you're
think
talking
that
about,
it's fair
if
to
you're
like
talking
dictate what
about,
farmers make because they provide food which is necessary for survival?
They do if they were withholding their food as the people were starving because they wanted a 5,000 margin compared to like a 200% margin. Yeah, I absolutely think that would be appropriate.
So farmers don't get to sell the food for what they think it's worth.
Not if you're marking it up
controls.
5,000%, and all the farmers are getting together and agreeing like, hey, we're all going to have this kind of market direction and trajectory, and we're not going to make options as available. And like this is
not happening. Generics are constantly competing, and once the patent runs out for brand new
not
drugs,
enough, clearly,
they go
but
into
we have an
generic.
access problem. It's not just the pharmaceuticals too, though, Lactoid. You got to understand, like all these things are connected. If you look at the insurance companies, let's get out of the claim conversation. We have 5 times the level of administrative costs with our insurance companies for comparable countries. Our average administrative cost for an insurance company on a claim, it's around $1,000. A normal country of our similar development and economic place is about $200. We have by far the highest in the world.
Again, with the cross country comparisons.
But you can't just minimize all the evidence by saying,
no, I'm minimizing the cross country because we've already addressed this.
We've already those either. So
we've already addressed the cross country comparisons, right? We've already addressed.
No,
there's plenty of reasons. There's plenty of reasons why healthcare costs are going to be different in other, depending on what country you look at.
Do you think diabetes is driving up the administration costs?
Who is spending? I mean, who is buying the healthcare as compared to who's
you think the
receiving
opioid
it
epidemic
is going to depend
administration costs
on a country. My question for you, Falsers, is:
do you think obesity gives us 5x administration costs?
It can, absolutely, it could.
No, they're admin costs.
You don't know that. There's a million other factors that go into whether
you understand that.
There's a million factors that go into determining what the actual expense is going to be.
I don't think
my question for you is why do you disagree with Bernie Sanders and Elizabeth Warren when they say yes, we're going to have to raise your taxes a little bit?
No.
Again, because our spending is already such that we have an allocation where if the industry was regulated properly, we would not need to raise taxes. We have a ton of wasteful spending. Killian was spot on when he pointed out the inefficiencies of our current government, both in the healthcare sphere and in other spheres. We need to regulate and tamp these things down.
Does any economist agree with you?
Two things before we go on. I got to make my money, gang. $5 for 𝕬𝖑𝖏 to say, why are we putting R&D of our medical care in the hands of companies with our tax dollars who then charge us for it? Second thing, $5 more to say from the same person, 𝕬𝖑𝖏, to say, why is that R&D not being done by universities and health organizations who aren't looking to make a profit?
The simple fact of the matter is the private company is going to do it much more efficiently because they're worried about profits. They're going to attract
money is important.
They're going to attract the best mind. I am a devout capitalist, right? In all other areas except for food and healthcare, I agree with you, Lactoid. I also don't agree with Falsers that we need nationalized health care because I think it's going to be a disaster and it's going to cost me more money.
It will cost you more money for sure.
Absolutely.
Yes.
It will absolutely cost me more money. So I'm kind of in the middle here, right? I just want to say that. I mean, this is another thing I want to bring up. Do you know what a doctor in Britain makes when they first come out of medical school? A year?
I don't care about
$30,000.
British people. Just
$30,000. Okay, that's barely enough to to live on, right?
What about one in South Korea? Spoiler alert.
I don't know. You tell me. What is it?
It's 140K.
Well, that's better, right? That's better. You're not going to attract the best and the brightest minds if you're paying them shit for wages. So that's another. So is South Korea the only one like that, or is it? I think it's.
No. That's my whole point.
You're going to find it.
The entire discussion is predicated on how inefficient our system is, and I love that you pointed out because we really agree on that. And so, like, we're trying to operate a system. It's like you're trying to build this like house of sanitation in a sewer, right? Like, everything's already kind of fucked from the get-go until we change what we have around us. But we can absolutely do that. Some simple regulation would go a long way in this nation. And Killian, again, like you can point to like one country here, but if we look at things in totality, we're just not seeing the evidence that says like, hey, private companies are doing better because of. It's simply not true. We're having worse outcomes economically and quality in a free market system right now than universal systems are having. And again, let's offer that private option. I'm for that. I don't want to eliminate it, but there needs to be a baseline to have everybody a basic level of access. And that encourages these companies to work harder because they know if somebody's going to pay them and that person wants to drop and just go to government, their quality has to be better.
I want a really quick fact check.
Yeah, real quick fact check, but then I want to kind of dig into the pharmaceutical company and R&D more because I think there's an angle that we are not talking about, but absolutely should. But carry on.
The $146,000 that he brought up about Korean doctors, that's on average. It's not about initial entry, people just coming out of medical school. And in fact, in the U.S., the average pay of physicians is significantly higher. Some rates between $208,000, $260,000 compared to in Korea about $146,000.
Yeah, when that happens, you're going to attract.
That's not a fact check.
Yeah. So he asked about entry level. He talked about entry level. The total average pay in South Korea is $146,000. That's like the average, right? In the U.S., it's significantly higher.
And that's still not great for a doctor. I mean, that's still not great for a doctor.
Right.
Interesting.
I mean, you can live on that, right? But it's still not what you would expect a doctor to be making.
Yeah. No, I mean that's fair. That's fair to call out, right? I might have misunderstood you, Killian. But the point still stands though directionally, right? So like the point you're trying to make, Killian, which I think is a reasonable argument to come at it from, which is like, hey, if we're paying better rates, we're going to have better physicians. Unfortunately, again, for that to be true, you need to see a qualitative difference in outcomes, and we just don't see it. And it is not enough to hand wave all the evidence saying like, well, our country's different. That doesn't account for every other nation in the world that's doing it different and better than us.
Well, let's talk about that.
Similarities in some of those areas,
sure,
and you can find differences.
Let's talk about the other countries for a moment, because one of the things that it could be argued by Lactoid's team, if you will, is the fact that other countries benefit from the massive amounts of R&D that America does. The reason that they have such good access to healthcare and things like that is because they use a lot of the developments done by America, funded by America, invested by American capital in order to distribute out to these other countries who then pick it up and they're used in their systems, which are universally. So it could be argued, not necessarily my argument, mind, but it could be argued that America's research and development is what's the word? Carrying on the back these other countries across the finish line, that they are leeching off the system in that way. How would you respond to that?
How would you measure that assertion?
Simply by looking at what drugs they use to treat their patients, right? What kind of treatment in terms of cancer and other surgeries and things, where are those techniques developed? Where are the majority of those drugs developed in?
Here's what you would need to prove. You would need to prove that meaningful enough amount of them come from the United States as the leader, right? Because we're
Sure.
certainly the
Mhm.
leader in like cost and everything and profit margins. And it would need to also correlate to the margins themselves as far as the weight that it had in order for that argument to hold enough water to be made here. And I simply don't think you could do it. Because the fact of the matter is, we have a world healthcare force right now, and all nations that are like, civilized and of similar economic and development, they are working on developing these things. And a lot of these research teams are multinational too.
Sure, we can
So
look at the COVID
this would be
vaccine
like,
as an
I'm going to be honest
example.
with you. I don't know if it's true or not, but I think it would be a very hard thing to measure or improve. And in that way, it's not an evidentiary argument.
Well, we could.
And it runs counter to all the other evidence.
I disagree. I think it is a data point, right? Which it counts as evidence. Now you could say it's not sufficient evidence, and that there are other
But you
factors
would
in
need to
play.
show it.
That's
You
fine.
can't just
Well, let's
say
look at an
it's a data
example.
point and it
Let's take an
counts.
example. Let's take the COVID vaccine, right?
Mhm.
Okay, that was primarily developed in America.
Yep. On
Yep.
tax money.
Money. And that's fine, right? But one of the reasons that we have the company, I think it was Johnson, the companies that were able to do it they exist because of the private investment and the profit margins that exist. They are incentivized. The market forces at play for these things to exist and have the infrastructure and the expertise that they do is simply because the primary reason is because of the capitalist system which America operates in. Is that not following? Does that not follow for you?
No, I don't think it does. I think you've got a lot of assumptions in there
Such as?
that simply don't track. I think, again, for you to say like, hey, this is empirically true, you have to like show the data behind it. But I agree that the United States led the charge on the COVID vaccine. But we didn't do that with the free market. That's the problem. You're helping my argument. We did that with U.S. tax dollars. I want to give credit to the Trump administration. In fact, I hope our conservatives love to hear that, because Operation Warp Speed or something like that? That was one of the driving factors.
Not all conservatives like Trump.
Yeah, he
Not all conservatives like Trump.
That's fine. Hey, I'm with you. But he allocated a large portion of our resources towards that vaccine development and really streamlined it, right? And then a lot of people didn't want to take it anyway, but for the ones that did, it helped. But that was a taxpayer-funded initiative. That was not a crown of the free market to wear and show off.
Okay, I want to get Leontes because he's been a little quiet, and I'm not sure if you have thoughts or not on this whole thing. What do you think? It could be about research and development. It could be about another topic. I just want to give you some space to get in here if you need. Go ahead.
Yeah, so I agree with 𝕵𝖎𝖎 and Killian generally when it comes to the research and development and the profit margins. I don't really have a problem with trying to get to the bottom of why, like they've argued, the profit margins are way higher than the cost of research and development. No problem with that. But I would like to drill down like on 𝕵𝖎𝖎's vision for what Americans would be enrolled into in this universal healthcare. So if you indulge me, what specifically, like, are you a Bernie Sanders type? You want to expand Medicare? Is there a different kind of plan that you would like to implement? How would that look for Americans?
Yeah, so I'm not going to like put it in a box with a politician necessarily, but I'm happy to expand on it. So I think I really like the South Korean model. If I had to like pick something to look at and hold a mirror up to, and what they have done is, and this is an important data point. Something like 70% of the South Korean population, they utilize the private healthcare option, but they are far more satisfied with their healthcare than we are. Why does that matter? Well, it's not because I'm anti. It matters because what they're doing is they're creating baseline in their system, the government care, the universal health care that I'm advocating for. There's a universal option. Every single person is covered. Now, it's not always the best option, but what it does do is it gets you through primary care, gets you through like prominent medical conditions in that country. But hey, if you've got a condition that like you need a specialized T for, the South Korean government option often doesn't cover those things, right? And so they will use private healthcare to get access to some of those specialists. And it's working really well because the portion they pay for their universal care is pretty
just
low.
FYI,
It's about
𝕵𝖎𝖎, you're
2.5%.
cutting out on occasion. Like on occasion, you'll drop a word or two.
Yeah.
Just
Hold on. Let me switch to push to talk.
Okay. Any questions on that, Leontis? You wanted to drill down? Go ahead, drill. I'll give you
Yeah.
space.
So I don't know about South Korea's healthcare. So do you know, like, is there private option? Because you say option, is that just one option, or is it like a market of competitors?
A market. It's a market. It absolutely is a market. But again, the market is more competitive because they recognize if they are not providing quality service, those people could always go back to a government option, or they can go to another private option, right? That is more regulated than what we have in this nation. I'm not for abolishing private healthcare. I'm not for abolishing the free market aspect of healthcare. I am for having universal healthcare. And I think where this conversation often gets lost is it's looked at as a one or the other solution, and it's simply not. And Lactoid asked me earlier if there are economists that agree with me, and yes, there's plenty. There are plenty of domestic ones, and there are plenty in the UN, there are plenty in the WHO that have advocated about how bad the healthcare is in America and how we could overhaul that system.
That's not what I asked. Is there any economist that agrees with you that we would not have to raise taxes at all?
Yeah, I think there are. I think there are. I absolutely think there are.
Whether we have
Any
to
examples?
or not, they will. Period.
Yeah, like
They
the
will.
ones in the WHO that again have provided this data. I'm happy to link you some sources after.
It's going to be an excuse to take
I'm
more
happy.
money.
So let's say, so I've read a lot on this. So I've read a couple economists and a couple institutions who said actually 2/3 of Americans, 65.5%, about of American households, comprising about 73.5% of the population, will pay more in taxes than they will save from no longer paying health insurance premiums and not having to pay out of pocket copays. My question for you is, if this is true, let's just, this, I've seen the evidence, right? But if this is true and it actually turns out that over 2/3 of Americans are paying more overall, are you still going to be in favor of this?
Sorry, I'm linking you some.
You're good. I'll ask it again once you're done.
No, I got you. I heard you.
I'll answer you. No.
So if we let me restate it, make sure I got it all. If 2/3 of people end up paying more, am I still in favor of it?
So if 2/3 of American households, comprising 73.5% of the American population, would pay more in taxes than what they would save, no longer paying premiums and no longer paying copays, would you still be in favor of your proposal?
Yeah, absolutely. Because again, the savings which you're trying to frame out of this would far outweigh the tax burden. What I linked you, by the way, was from economic professors in advocacy of Medicare for all, which I am not necessarily in favor of. That's a much more extreme solution, I think, with bigger economic burdens. But even that has economics professors advocating for it. So I certainly think it is a reasonable position to say a middle ground system that offers both a free market and a universal healthcare option is economically viable.
Two questions, one for Killian and then one for you, Falsers. Okay, Killian, you responded to Lactoid's question with no, right? Would there be a level of cost increase you would accept? So say the cost increase wasn't very much. Maybe you average they paid $100 more a year in taxes. Would that be a deal breaker for you? Is there what I'm asking? Let me be more clear. Is there is there a what is the threshold, right? Of would you be willing to pay any increase for better outcomes, and at what point would that change? So 100, no, but at 10,000, probably, yeah. I'm assuming. Yeah. So I'm just trying to find your line.
From what I've seen, they're talking about for people then, in my particular tax bracket, it going up as much as 50% of my income, which I already paid out. State and federal income tax, I paid 37.5% last year.
Okay, so a significant 13% increase-ish.
Yes.
Okay.
Yeah, that's a no. If it's $100 a year, okay. Yeah.
Fair enough.
But I still, Wick, I still have a problem with it's not going to be ran efficiently. And I still think there's going to be a ton
Can you elaborate on that? What do you mean by efficiently? Falsers has given you examples of other countries who have ostensibly, right? If you believe his data, let's grant it. Yeah. Let's grant it for the purpose of the discussion because we don't have time to go line by line, right? So let's grant Falser's point here that Falsers has provided evidence that in South Korea and other countries that they run these nationalized systems efficiently. Why do you believe we cannot in America? What is the exceptional thing about America that makes it not work here, but it works there?
The evidence I have now on the things that the federal government does with our money now, are, like I said before, last year they wasted $247 billion in taxpayer money. That's a figure by the government accounting office. The Pentagon doesn't know where $221 billion they paid out to contractors went. 61% of the Pentagon's assets are missing. They don't know where they are, right? So we've got one gigantic program, which is the military, right? Which I love the troops, I love the military, support the military, all that good stuff. Don't come after me. We need it. I think we have to have a strong military. But and then we've got the other part of it, which I didn't drill down and see what that $247 billion was wasted on, but it's probably social programs and things like that, maybe grants. I don't know. But the evidence I have says that their past record says they can't run something without wasting a ton of money. I believe that private insurance companies, private hospitals, and private pharmaceutical companies, even though I think they make too much and they could be capped on some of their profits, will be far more efficient than the federal government can do when running a healthcare program.
So, Killian, if there are other countries, and there's a lot of them, that have a lower tax rate than us in terms of attribution to healthcare that are doing this, why is it you think the United States would need to raise it significantly? In your words, as high as 50%, in fact.
Mhm.
And again, South Korea, your
I
attribution
think-
from your paycheck is about 2.5%.
which I would probably be okay with, right? But that's not going to happen here.
So let me ask you this. If we could do this in a way that is fulfilled through regulations where the tax burden is not outrageous on you, would you principally get on board with universal health care?
Yes, under certain conditions.
Fair enough.
If they deserve it, right?
If
I'm
they
going to
deserve
keep
it.
bringing that up. Before you go, Lactoid, Matt Honeybee for $5 says this. What is the panel's stance on how much ambulance companies make? These are for emergencies. Your lifestyle may have nothing to do with needing one. I don't know how much ambulance companies make.
So my brother-in-law used to run an ambulance company. They don't make that much money. I mean, they do okay, but they don't make a tremendous amount of money.
There's natural
Lactoid,
competition.
before you go, I have a question for Falsers that I wanted to get to before we get too far off. So I asked Killian his question. Falsers, to you. Given that we do have an example of government-run healthcare in America, we have a couple, right? We have Medicare and we have the VA. Both are entirely government-run, as I understand it, right?
God, don't get me started.
Do you like these systems? Do you think that they're a good basis? Like, if we can't do it for our veterans, why do you think we will be able to expand these things on a national level? What's your thought process here?
So those are two very different questions, and I want to point that out before I answer. Medicare and VA are very different systems, right? So I've got to kind of give two answers here. I'll start with the VA because I think it's the more problematic of the two by a large
It's
margin.
horrible.
Yeah.
It's terrible.
So
it's a disgrace.
When I advocate for regulation, man, the VA is at the top of that list. With the way the VA operates is awful. It is awful. It is frankly predatory towards our service members more often than not. They are incredibly difficult, and they themselves are doing a disservice to the people that have gone out and fought for their right to operate in the first place. I take a really principled issue with the VA and how they
Yep.
run. You also have to understand that they are running in the context of the system we have in a lot of ways. And the VA often has ties that incentivize them to deny legitimate claims and assertions from our veterans in the name of money. And more regulation, either adjacent to them or directly on them, all helps to mitigate that. So that's the VA.
Okay, but before you move off this point, I want to dig into it a little bit. So again, we have an example of the VA, right, being predatory and taking people for a ride, like the veterans. And as a veteran myself, I can attest it's not very good care. And again, I had to privately raise money to fix my teeth, right, because this is cosmetic, right? It just doesn't
That's
cover dental.
pathetic.
There's a lot of issues with this, right? And I don't even know if what I've raised will
That
cover
pisses
this.
me off.
It pisses me off too. I understand, but again, given the context of the country that we exist in, and the system, the capitalist system which we exist in, right? How do you think it's going to be better when we nationalize these things? Look at Obamacare, right? Look at how, while there were great strides made, I would agree, right? We can look and see how insurance companies embedded themselves into that process to stimulate it and make it not what was originally laid out by the administration. We could see it corrupted it. It turned it into something that was absolutely different, I think, fundamentally so from what was envisioned by most people.
This is a diversive point, and what I mean by that is it diverts from like the greater body of evidence, but I'm happy to jump in and address it with that preface being understood. You know what, Wick, let's grant you this whole thing. Killian, let's grant it. We can't do a damn thing right. Let's get rid of Medicare. Let's get rid of Medicaid. Let's get rid of infrastructure planning. Let's get rid of food stamps, school lunch, tax credits, loan subsidies for home buyers. I don't know, fucking Pell Grants, assisted living subsidies, community development funds, Social Security, public school. Let's get rid of all of those things because they're all social programs. I see Lactoid doing a thumbs up.
Public school, I'm good with. Yeah,
maybe he's doing a thumbs up on one. Maybe he's doing it on two. Maybe he's doing it on three. But I bet he's not doing it on all of them.
Public school's a disaster.
I don't think it's all. I don't believe you when you say that, Lactoid. You're too smart for that. So the reality
more than you listed, actually.
We have programs in this nation that are working to a degree where we see meaningful, measurable improvements to our quality of life as a result of them. They do exist. You may not love all of them, but some of them are there. You may take issue with some of them in a big way. Others, I imagine, are pretty helpful. I'm glad we have social services for children that need it. Now, it could be better, but I'm glad we have it, and I certainly don't want to see it privatized and companies out there charging us to check in on abused children and making that a free market proposition.
Do you think the CPS is a force for good?
I think there's a lot of problems in that system. A lot. But here's my second part of that point. I'm glad we don't have a free market model for that where we're charging people to check on our children.
Okay.
Right? That creates a whole series of problems within itself. Sure. So, Medicare, not perfect. Could be better. Better than not having it right now. That's my take.
Okay, I know Lactoid went in here, so go ahead, Lactoid.
Just a couple things. First of all, I would argue for cutting a lot more than what you just said. So, and a lot of what you said. So, I agree with you. A lot of these social programs are actually socialism, and for some reason, people don't seem to think of it that way. Like the old people, I'm against socialism, but you're in favor of Social Security and Medicare. That's a little bit
you paid
iffy,
into
right?
it.
You're being generous.
We all paid into it. Well, okay. This is the thought process behind every Ponzi scheme ever. I also read the article that you sent me, Falsers, and I want to point out that
I didn't get that article.
The Economist, it was DM'd to me. But I read through it, and the economists that wrote that article.
I don't agree with everything in that article.
I want to point out though, the economists, the title is "We can do this without raising taxes," but when you actually read the article, they admit you will have to raise taxes. They're just calling premiums and copays what essentially is a tax. That's what they're arguing. So everybody agrees taxes have to go up. The only real debate is whether or not the insurance premiums and copay is going to be more or less than the increase when it comes to taxes.
We got different takeaways from that article, but that's okay. And what you asked me to do is provide you with an economist who would posit an argument for how to do this without raising taxes. I don't agree with all the methodology in that article. That wasn't my goal in sending it to you. I can tell you of a few ways personally that I think we could do it without raising taxes if you would like. I can send you some more articles from other economists that would agree that we can do it without raising taxes. But I don't think the point of today's panel is for me to send Lactoid 5 articles on a
Okay, but the one you sent me, they said we're going to have to raise taxes.
I don't agree that that's the takeaway from it at all. I think they made a great argument for how we could.
Can one of you post it in my Discord, or not my Discord? Can you post it in my Twitch and YouTube chats so everyone can know what the hell you're talking about? I don't know what the hell you're talking about. So
can I bring up my other point about nationalized healthcare?
I can link it. It doesn't matter. I'll link it.
You can link it up.
While they do that, go ahead, Killian.
My other concern is making people dependent on the government, totally dependent on the government. If they can get you totally dependent, they can dictate what you do, right? Dictate how you live. Who's to say that They tell you that you have to be under a certain weight in order to continue your health care, or you have to stop drinking in order to continue your health care.
Isn't that about
that can go into
deserving
a lot
it?
of
So the government
that can,
gets to decide who deserves it versus you?
I'm not saying that's right. That's
Okay.
right. I'm concerned about people becoming dependent on the government for their food, their health care, for everything, electricity, all of it. Because when you do that, they can dictate to you when and where and how and what you're supposed to do, and they can hold that.
How is that different from laws in general? Like, the government does tell me how I can live my life. They do provide restrictions. I can't go out, take my gun, and start shooting randomly, right, in the air. I would get arrested.
That's true, but it's all about scale, right? Like how far they're willing to go. How
what realistic? I guess let me ask you this, Killian. What the realistic? Right. I want to dwell in the land of the real here, if we can. What is your realistic concern that a nationalized healthcare system? What restriction, law, requirement, anything like that would be that you fear being put into place that would be something you would be not okay with?
For instance, the whole thing around the COVID shot, right? And
elaborate, please. Well, don't elaborate too. It's YouTube. Be careful with your elaboration, but go ahead.
Okay. The only thing I want to say is that I think we can all agree, and I'll keep it brief. I think we all agree that there was some sort of form of control going on there. Like, you could lose your job if you worked for the federal government. If you didn't take it, you could lose your job, so on and so forth, right? And even the healthcare industry as well. If you don't do this, this is going to happen to you. And so that would be my concern if you had a nationalized healthcare system and you maybe had people dependent on it, and they said you had to do this or you lose this. That's my big concern there. And I'll leave it at that.
But Killian, we have that now, right? So we have that with our free market and insurance companies. So pre-existing conditions, I think, are the most prominent example of this, right? And so people will deliberately have to hide pre-existing conditions prior to getting insurance, so these things are covered and they can get treatment for them. So
didn't we get rid of those? Didn't we get rid of those with the ACA?
No, pre-existing conditions are still a problem. We've had
aren't they way less of a problem though?
Denied recently because of pre-existing conditions.
Aren't they way less of an issue though?
Regulation is better.
Than it used to be?
No, it's not. It's not anywhere near where it needs to be.
Okay.
There's still a huge issue.
Okay, fair enough.
I'll leave it at that. I'll leave it at that. Wick, I don't want you to get banned.
I get you. I do think there's a substantive difference between pandemic versus just general healthcare. I think the situations are different. I guess to Leontes, if I can ask you a question, right? Given that your goal here is to increase the amount of insured, right? To increase those covered, right? And who are able to have access to healthcare in general. Do you just want, is there any role the government can play in that you would find acceptable? Like when it comes to either regulating drug companies, when it comes to regulating hospitals or other private organizations, what level of government intervention would you think not only is okay and fine, but actually would advocate for and say, hey, we need to do this, and this as a government. Even though nationalizing it is too far, I think the government should absolutely do X, Y, and Z. Go ahead.
So from a fundamental point of view, I'm not saying I would implement this, but from a fundamental point of view, a capitalist kind of worldview, when you have a lot of demand for something, that will naturally increase the supply as companies, want to produce that thing that people want and sell it. And regulations put on top of it, just from a basic theoretical level, will limit that supply, raise the costs. So I think if you really wanted to just get people access to things, it would be to lift regulations.
Do you have an example of a regulation you'd lift on the healthcare industry?
I don't think I would lift enrollment periods because I understand why they exist since the ACA, but that's like one little tiny thing that I could think of off the top of my head.
Can you define that for my audience? The enrollment
period is a specific time period that you can enroll into these plans, and it's different depending on your situation if you're like enrolling into Medicare, or if you're enrolling in a group plan, stuff like that. So they're like set windows that you can enroll, and it kind of limits like the supply because you can only enroll during a certain time. So that's one tiny thing that might help. But then again, I understand the argument for why they exist. It's to prevent people.
Do you have one that you just like wholeheartedly, without any kind of conditions, and just say, no, this regulation is holding us back. We need to just nuke it from orbit?
No, I don't. I'm not against regulations, just out of principle.
I'm
but
curious.
I'm curious if
I'm curious if 𝕾𝖏 has a different answer.
If there's regulations that I would nuke from orbit?
From healthcare, and healthcare specifically.
Oh, you were about to get a whole bunch
No,
of...
I didn't want to. I
It's like all of them.
Yes.
Boy, do I out of a book for... No. Insurers should be able to sell insurance policies wherever they want in the United States. There should be no geographical limitation. That's one regulation I would just remove. There's no reason to keep it state by state. I think it's part of a racket, actually. And then one regulation that I actually would impose, again, to try to like combat the racket, would be in the interest of preventing fraud, because I think the healthcare industry is sort of rife with fraud, is more regulations on transparency.
Can you give me an example of these frauds that you claim that is rife with, and can you kind of talk about that a little, elaborate on it a bit?
Sure. So when I go to a grocery store and I buy a banana for 69 cents a pound, of course, disproving food deserts, I know exactly what I'm paying when I take that pound of bananas and take it home, right? I don't get to the service counter and then as I'm checking out the banana, oh, actually, this is a $35 pound of bananas. I would be infuriated. That's not what the sign said. That's not what we agreed upon. That's not what was honestly represented to me as a consumer. This happens in the healthcare industry all the time, I've had this happen to me as well, right? You go in and you're like, okay, this is what I'm going to pay. I understand that. And then you pay that, and then you continue to get bills after the fact, right? The costs continue to be off the charts. If you ask a hospital, what does this operation cost? They're not going to tell you because they don't even know, right? All it's going to depend is, afterwards, we're going to find out how much you can pay, and then we're going to charge that amount. I think that system is broken. I think the best system would be a transparent system in which before the point of service, of course, like the 6% of all healthcare spending that goes to emergencies, this might not apply to that, relatively small percentage, but most healthcare expenditures, before the point of service, you give the consumer like a little piece of paper saying, this is exactly how much you are going to pay out of pocket. This is exactly how much the insurance company is going to pay out of pocket. And then once they lock that in, it is illegal for them to charge more after the fact.
What's the term you would use to describe that provision? I would call it regulation.
Yeah, like I said, I think I even said at the beginning, like this would be one regulation I put forward. I am okay.
Okay, so you're not anti-all regulation.
So it depends on what it's being used for.
What if you have a heart attack during the surgery?
It depends on what it's being. If that's like emergency situations is a whole different topic, right? I'm talking about specifically for the operation itself.
I have a question.
I just want to quickly say I'm opposed to regulation generally, but there is some regulation that I think is like philosophically founded. And one of those are because my foundation is free contracts and consensual agreements between willing parties. Part of that requires transparency. And anything other than transparency is like fraud. If I sell someone a car and because I use like a drill to reverse the odometer, then this would be fraud because I'm not selling you what you thought I was selling you. Healthcare does this all the time legally. It should be locked in what you're going to pay. And so and in fact, on top of that, then you can get like an estimation. Okay, this hospital is going to charge me this. This other one's going to charge me this. This other one's going to charge me this. And then you can make like a market-informed decision as to where you want to go.
So, 𝕾𝖏, largely, what is your objective when you say I want to deregulate things generally? Like, what's the end goal with that? What are you trying to accomplish?
Right. So, like I said at the beginning, like my principle here is one based on I don't think people are just by virtue of existing are entitled to the resources of others, but I do think that people have the right to freely contract and freely negotiate with other people. And so I'm okay with steps taken to make sure that people are not having their rights violated, and that they know what kind of contract they're engaging with. But I'm not okay with regulation saying things like, okay, the buyer knew how much this cost and they consented to buying that much, but we don't think that's a fair price.
So is
So
that,
we're
hold on, is
gonna
that your end goal? Your end goal is that you want people to understand is there a bigger goal? Is there a reason you want them to understand? That's what I'm trying to get at. What's the end goal? If we connect all the dots, what's the last dot?
that is the goal is to have a system in which people which the economy is simply people making informed, rational, consensual agreements with each other for everything, including
Okay.
healthcare.
So if in that they're making informed and rational decisions, but the circumstances in which they have to make them are such that they're paying 5,000% markups, you're okay with that as long as they understand the markup's 5,000. You're good with it.
Yes, I'm okay with that.
That
Yes.
is
I think his
Absolutely.
philosophy.
not
I think
only
his philosophy is that somebody else will charge cheaper, right? Be less money.
Well, of course that will
Market
happen, but
conditions.
yeah.
Yeah.
Yeah, one of the reasons
it kind of didn't.
one of the reasons I am in favor of, you can point to like medical innovation rate in the United States, which is number one. But when you take a look at this, like there's, believe it or not, the vast majority of right-wing economists, obviously, but even like a significant amount of left-wing economists, so like the vast majority of economists overall are actually against when companies charge a lot of money during like an emergency. What's it called? Price gouging. Like they are against laws prohibiting price gouging. And the initial like emotional reaction to that is, whoa, they're taking advantage of a disaster to charge more money. That's obscene. That's immoral. They're charging this much more for like toilet paper. They're charging this much more for bottled water. But like the reason why economists like overwhelmingly are against these laws, against laws prohibiting price gouging, is because price gouging is like actually beneficial. Price gouging actually leads to an increase of availability of goods.
Is beneficial.
Yes, it leads to an increase of availability of goods to disaster areas, and it encourages businesses and stockpilers to maintain stocks of particularly important goods, because then they know that if a disaster happens, those goods are actually going to make the profit necessary to overcome the overhead with storing it prior, right? But as we currently have it, because you can't do that, there's no actual incentive to hold on to those goods for a disaster, because when you sell it, you're going to be limited as to the price you can sell it anyway.
Hold on, I'm 1v3. Let me get in here. I principally don't really want to engage on price gouging as beneficial because I think it's absurd at face value. But you've been kind of keen tonight, Lactoid, on explaining away data. So I want to give you the opportunity to do that a little more. In the 80s, the Reagan administration really fought and was successful in deregulating the healthcare system. And we saw a subsequent rise in people that were uninsured. It was 15% increase in uninsured people over the next 5 years after the Reagan administration's deregulation. I'll let you go ahead and tell me why you think that is if deregulation is so good.
What specific regulations did the Reagan administration remove?
I can't point to all of them specifically, but I can tell you he changed a lot of the boundaries in which insurance companies were operating in. And so before, when we have conversations about like pre-existing conditions, right? Those regulations were stricter prior to the Reagan administration. When we have conversations about rates and price caps, those regulations were stricter. So Reagan had a sweeping effort to deregulate the insurance industry. It's you can find tons of information on it. So again, we had a 15% rise after deregulation in uninsured rates over the next 5 years. Why do you think that is?
So I haven't done a full analysis as to Reagan's cuts in particular, or Reagan's policies in particular. I would have to see like, okay, you're pointing to a 15% rise in like uninsured rates. I'm guessing people, if this is like we're talking about public insurance, perhaps people who were insured under public programs beforehand. I don't know what the cost savings are, considering that, like in exchange for whatever increase in uninsured that there were, like what percent of people began paying less because of these cuts. There were things that Reagan did that I thought were really good, and I think there's a reason why Reagan did oversee one of the greatest expansions of
He was great. So like
the U.S. economy, and by the way, Bill Clinton as well,
principally,
who Bill Clinton, who also cut welfare.
Principally, we should deregulate to decrease government spending too, right? So like government spending's bad if we're against social programs. Would you agree with that? We want to decrease government spending.
Ideally, yes, unless there's like a justified reason for it.
So then why in Reagan's deregulation did our attribution of GDP spent for healthcare nearly quadruple in terms of proportional to like inflation spending over the next 30 years?
Are you talking about spending on like healthcare in total, or are you talking about tax expenditure, stolen money?
I'm talking about total GDP.
Okay. Well, what you said doesn't necessarily contradict what I said beforehand. You're
Right,
saying,
so
well,
I'm
if
asking
you-
you,
if you're-
Lactoid, if
what I'm-
deregulation is supposed to lead to less spending, why has our attribution of GDP increased so much? And it's
Well-
outpaced inflation.
it can lead to less government spending. If there's more like overall private spending, I don't think that's necessarily like a
All right.
problem.
To be clear, our proportion of tax money being used for it has changed as well at that same trajectory.
So you're saying Ronald Reagan's changes led to more tax money being spent on this?
Yep.
Then I'm opposed to his changes?
Does this take into account population growth or no?
I would have to check. I don't know offhand, to be honest with you. Well, yeah, no, it would because it's per capita. There's like per capita analysis on this, as far as the tax proportions per person that support this. There's like a national basis for it in terms of GDP. There's a tax basis for it, and as far as like the allocation of tax money being attributed towards healthcare. I mean, it's everywhere. The deregulation was a purely bad thing across all primary economic factors for our market, except the profits for pharmaceutical and insurance companies.
Look, if I have to look at, like I asked you for those specific like deregulations, I'll have to look at the specific deregulations. And if you're saying they led to an overall like per capita increase in tax dollars spent, if they caused that, then why would I be in favor of those decisions?
That's what I'm asking you. If principally you're for like
And I
more
wouldn't be.
deregulation and decreasing government spending, and we see at an evidentiary level that deregulating the industry and the way that
That's
we've done,
not
which,
proven.
hold on. By the way, the way that we did then is basically still the way we have now. Not a lot has changed since the Reagan administration's deregulation. We see problems in today's systems. It seems like the more regulated system was a better one.
Look, I'm giving you a lot of charity here because you're bringing up like a specific example as to what were Ronald Reagan's policies. Now, I know that Ronald Reagan had a number of policies that I disliked. In fact, he made it much easier to get disability. And surprisingly, you see disability claims over triple, quadruple ever since he did that. There are issues with Ronald Reagan. I'm not denying that. And in terms of like what he thought the government should cover and what it shouldn't cover, he wasn't actually all that small government in a couple of ways, which I think was problematic. And in those ways, I would disagree with him. But if what you're saying is that Ronald Reagan's actions led to like a higher increase of tax spending on this, which I know you're against, would you then be against it? Then yes, I'd be against it. I'm not, but you can't attribute that to like, well, that's deregulation now. So in order to lower the overall tax burden, we need more regulation. No, you're pointing to you're pointing to like an unspecified Ronald Reagan policy that you're calling deregulation, and you're telling me definitively.
You say you're being charitable, and you're asking me to quote every regulation in a bill from the 1980s. That's not charitable. That's absurd.
No, it's charitable. No, it's charitable.
The regulation.
No, you did not.
But they're there. Would you like me to provide them again?
The connection you're making is the connection
Would you like me to provide them again?
Let me finish. The connection you're making is uncharitable, right? When you're saying, well, because this specific deregulation occurred, that you're calling a deregulation. Now, I'll take a look at it if you want to send it to me. And you're saying this definitively led to a tax increase in the American people. Then, I mean, first of all, I would be opposed to it. But second of all, perhaps there's a way to do it without increasing the tax burden on the American people.
Lactoid, I don't feel inclined to send you hardly anything because of the 30 data points I've pointed out tonight. You've hand waved them all away by saying, well,
I read it. I've read everything you
should provide me with some evidence that the lifestyle changes you're asserting negate every other data point actually do so.
No,
but you're not going to do that either.
That's not how this works. That's not how this works. You can't. No, that's not how this works. You can't.
It's exactly how this works.
You cannot assert. You are making a positive claim. You are asserting a cross-country comparison.
And I gave you
no, I understand. I've seen all those sources. I even read the fucking paper that you sent me that said something that you didn't say it said.
Let me read you that. Hold on. Let's read the last paragraph of that paper since we're stuck on it.
Oh God, I don't want to read the last paragraph of the paper. I just stop. I will stop you. Oh my God, I will stop you all. Okay, stop. I don't want to read it. I don't want to read this. I don't want to get lost in the weeds like this. I want you, right, to address each other's points, and I think you're missing each other by miles. And let's get back to this. I want to reset, okay? a little bit and ask directly to Lactoid first and then to Falsers, right? To Lactoid first. Given the fact that Falsers has pointed to all these different index data points, and I understand why we've gone over why you don't think that cross-country analyses are valid, right? And I will grant you that lifestyle plays a role in this, right? But can you not also see how our specific system of providing healthcare for those different lifestyles also plays a role in our low standing amongst the healthcare and a worldwide stage? Do you not see the connection here? Like, for example, even if our lifestyle is terrible, right? Should we not provide healthcare to match our lifestyles, like a level of healthcare to match our lifestyles? Obviously, there's a disconnect here between our lifestyles and the level of healthcare provided to us. Yes?
Well, what I'm saying is that when you have like an unhealthy lifestyle and you have like a country like America, regardless of the system you implement, you're going to have a more expensive healthcare system. That's what I'm putting forward. And you can't just say, here's this country, here's this country. Country A pays this much per capita. Country B pays this much per capita. Obviously, there's a problem. I'm challenging the validity of that data. I am not making a positive claim. I'm not saying America has a better cost effective ratio when it comes to healthcare than other countries, because I don't know. We can't like just take a look at the raw, well, this is what we pay compared to this is what we're getting. We just can't do that, right? And the best example of this is infant mortality brought up. Well, when 98.6% of all babies are born in hospitals, where's the access problem?
I agree. I think you don't know. Let me ask you this, Lactoid. Do you know what preventable deaths are and how they're measured?
Preventable deaths, how they're measured.
Yep, it goes to the heart of your point. Sorry, I didn't hear you.
I don't know.
Okay, so preventable, I'm going to read it to you. I'm going to read you the exact description of it. The concept of preventable deaths covers deaths which could have been avoided by public health interventions focusing on determinants of public health such as behavior, lifestyle factors, socioeconomic status, and environmental factors. All these things you're pointing to try to say it invalidates all the data. Here's a chart of just preventable deaths. And what you're going to notice on this chart is the gap between the United States and the other countries. And we're doing bad. There is a gap there too, which is what you're trying to point to invalidate everything else. That gap is not as big as the gaps on the other metrics where we have problems. So you can't just hand wave it all away because the correlation doesn't line up. If you have like a 20% gap between this thing you're pointing to invalidate everything else, it can't invalidate the thing that's got a 300% rift between it. You know, you cannot point to just lifestyle factors to hand wave off the other 30 things that have been presented to you. It just doesn't work that way.
Yeah, I can't see. I mean, the chart you're pulling up is incredibly small on my screen. I can't.
Bonzo, thank you for the raid. 16 individuals. Thank you. Welcome. Hit that follow button. Give me subs. Give me money. All that. Appreciate you. Okay, continue on.
Yeah, so I'll take a look at what that specific chart is measuring. I've got a feeling that, again, it's not taking into account all the hundreds of different variables that exist between countries. This is kind of like when people take like homicide rate between countries. I mean, not due to any one particular factor.
Again, you're on a quest to explain away every data point without providing any evidence.
I can't see your data points; they're too small.
I'll send you a link, I guess, for this one too.
Okay.
I can't see him.
Okay.
I mean, to be fair, I can't see him either. So.
Yeah, it's even when I click on them. I mean, I can kind of see them, but it's blurry.
What is this? Data points for ants?
You're not asserting that lifestyle changes in the U.S. the diet, everything that's involved with that would not be beneficial to the cost of our healthcare system. Are you saying that?
No, I'm not certain.
Okay, because that's delusional. Okay.
No, I'm saying that's not like that factor does not somehow eliminate all the other evidentiary factors from the discussion. That's what I'm saying.
Okay, but when we talk, okay, this is to you then, Falsers, right? Because we've talked about gun control before. And people bring in a myriad of factors for why there's a lot of gun issues in America. And yet the argument that you continually point to and the data point that you bring up to assert your argument is it's the guns. And yet you are seeming to use this data point much in the way that Lactoid is using his single data point of health lifestyle in order to wave away all those other myriad factors. So why is what you do different than what he is doing?
Wow, Wick, that's an easy one for me to answer because school shootings are fundamentally different than healthcare as far as systems go. The healthcare system is built to prevent illnesses, and we have a series of checks in place and like markers in that to prevent them. And the school shooting issue, we could just remove the gun. I don't understand this analogy at all. Maybe you could expand and help me out with it.
Sure. Do you think that just removing the guns would increase or this seems to be the same argument of like all we have to do is get rid of the drugs and then people
Hold
won't
on.
drugs anymore.
Do you think eliminating obesity is going to change the fact that our prescription drugs are double the cost? Do you think eliminating diabetes?
I think obesity will eliminate a lot of demand for prescription drugs. Absolutely.
I do too. Yeah.
Hold on.
He's right.
Let's walk through that. You think it's going to eliminate the cost?
Yes,
By the way, we don't have a supply problem with the drugs for obesity.
No, less people will need to pay the cost, right?
We have an insurance problem with obesity drugs, just so we're clear. Insurance companies are denying claims for obesity-related drugs.
Obesity,
supply and demand.
Obesity specifically affects so many other health issues, right? It's I
love the obesity example. I want to dive into this. I want you guys to understand this is not a supply and demand issue. We have had drugs come out for obesity, right, that are shown clearly to reduce obesity. So like things that reduce appetite, things that reduce, it's like a hormone that you produce that triggers hunger. I forget what it's called. Drugs that help people with these eating habits, make them skinnier and make them healthier. And do you know what insurance companies did that were previously supplying those? Because as soon as they came out, they were shown to be effective. They said, oh, well, we're not really sure that just being fat is really a health condition that's life-threatening. So we're not going to cover it. This is actually like an aesthetic choice you're making. It's not a health choice. And they've stopped covering these things. That is a regulation issue, okay? That's not a supply and demand issue.
I'm not disagreeing with you here, but that's not my point.
If you're trying to say it's supply and demand, that's absurd.
No, what I'm saying is, right, that if we solve the obesity epidemic in America, a lot of other health issues, right, would go away. Regardless of how we solve it, I don't care if we do it nationally. I don't care if we do it through the drugs. I don't care if we do it through the high lifestyle. I don't care. What I want, what I'm trying to say is that if we solve this issue of obesity in America, it solves a lot of our healthcare issues. It is a keystone variable. It is what is affecting so many other variables, right? It has having these insurmountable, like it has its little fingers, its little fat little fingers into into almost every other health condition that we have, right, in America. And this is absolutely a variable that if we eliminated it would make all these other problems, it would mitigate them to a large degree. Do you disagree with that?
Yes, I do, because I just walked you through why it would not eliminate the gap in prescription drug prices, because that gap is not predicated upon a supply and demand model.
But as you said earlier, there are so many other spokes.
You're not bringing the prices down.
Okay, but then it might not solve that problem, but there are so many other problems with our healthcare.
That's the problem, right? Exactly. There's like 10,000 of these problems. So to make this conversation reductive and straw man the fuck out of it and say, well, you know, we can solve the healthcare problem. People should fucking jog more. That should fix all of our systemic issues with 5,000%.
Won't fix it all, but hell, it'll mitigate it.
With 27.5 million Americans that are uninsured. Hey, you know, if we jog more, we might see our infant mortality rates go. We might close that gap where they're almost double. You know what, Lactoid, you're right. We do have people on drugs. That must account for the fact that we have double the rate of infant mortality. And you know what? Also, the maternal mortality rate in these, it's like 4x similarly developed countries. So maybe just jogging more should solve that.
Despite the fact they're all in hospitals and they're getting birth.
This goes on. I don't want to keep monologuing on it, but like this just goes on and on and on. It's patently absurd. If we see there's an issue with access to healthcare because of economic reasons, you solve the economic reasons. You don't gaslight people by being like, maybe you should have fucking jogged more. It's silly.
Can I quickly ask you, this is kind of just a question as to, I guess generally it was the beginning was like, well, this is about social structures generally. But I'm bringing up this point as sort of a comparison to the concept here of cross-country comparisons. which country do you think has a better like educational system? The United States or Sweden?
I'm not sure offhand. I don't know that I've done enough research on that between those two countries to answer
Okay.
you.
What about the United States and Germany? United States and the UK on Canada. Do you know any of these comparisons?
I don't. Healthcare is something I'm very passionate about. Education I care about, but I'm not as passionate as I am about
Sure.
healthcare. So it would be disingenuous for me to tell you I understand it to the level I do.
Fair enough. So the United States has worse education outcomes than the countries I just listed, but yet we spend considerably more than them when it comes to public school education for our kids. So I guess the question is, why do we have for a public program in which we're using public dollars to send every kid to school? Why are we paying more but getting worse outcomes?
I would take you back to my very first 2 minutes of this discussion, wherein I said we cannot simplify our arguments for these problems. Our healthcare system is a complex thing, and it is a thing that needs really specific diagnoses and solutions. And it is not sufficient in terms of argument for me for you to say, well, there are other systems that work nothing like this, and they failed, so therefore this would fail too if we implemented solutions that were in some way philosophically the same.
Well, no, the issue here. The issue here is most of your argument, this entire discussion, is based on this country spends less and gets better outcomes. They do it differently. That's why they're better. I just gave you an example of where we spend more money, we get worse outcomes, and we do it the same. If your whole argument is, well, they do it differently and they get better outcomes for the cost, how can you guarantee that's like this is the reason?
Again, I've just answered that. So when you say, how can I guarantee this is the reason? It would be the 30 different specific metrics I pointed to. And I explained to you, these are all telling the same story, right? So we go back to the wheel analogy of if we have 30 spokes and they're all converging on a similar, the same central point, you start to get a narrative. Go ahead.
Okay, I do want to get more people in. I know Leontes had his hand up and Killian wants to go. So Leontes first and Killian, go ahead.
I actually got to bounce in like 3 minutes.
Oh, we are at 8 o'clock, aren't we? I'm going to give you a closing statement, but then we're going to address that and we're going to wrap up. Time got away from me. It's been a discussion, gang. We've had quite the back and forth. Before you go, right? Just to do my shilling tomorrow, gang. We're going to have a YouTube exclusive. We're going to have Destiny. We're going to have Straight Raid. We're going to have President Sunday. And we're going to have chief editor of Aereo magazine, someone who has written for Quillette and the Queer Majority, free speech absolutist 𝕬𝖎 𝖙𝖚 on. And they're going to be discussing censorship, corporate responsibility, algorithms, and how this all plays together. And what responsibility do social media companies have to provide balanced information or to fight against misinformation? It'll be a banger, gang. It's going to be at 6 p.m. Eastern tomorrow. But I want to give our friend 𝕊𝖚 an outro. Go ahead.
Thank you, Wick. As always, thank you for having me on. Thank you, Followers, for being a good sport and taking such abuse. Thank you to everyone else in the panel for talking to me. Last things I just want to leave you guys with, I linked the study in chat. 2/3 of American households, 73.5% of the population will pay more in taxes than they get back in no longer paying healthcare insurance premiums or copays, and 5% of Americans make up 50% of all healthcare spending. I think knowing that information makes it clear what this policy would do for most Americans and how that would shift responsibility for paying for the services that people incur. If you like what I had to say, you could find me at 𝕊𝖚 on Twitter, Twitch, and YouTube. Thank you.
Have a good night. But I wanted to get Leontes and Killian. I want you to be able to address.
Is 𝕊𝖚 leaving right now?
Yeah, 𝕊𝖚 has to.
I gotta go. I got another panel.
Before you go, I just want to say I enjoyed it. I find you a very good faith person to engage with, and even though we don't agree on anything, I like talking to you. So,
hug it out, gang. Hug it out. You guys can do this in DMs privately. That's fine.
All right.
But yeah, I love you all. But anyway, go ahead, Leontes, and then Killian.
Yeah, so I guess I can kind of address some points and wrap up myself, do a little bit of a closing. I like to think I'm fairly open-minded, and if someone can, on Falser's side, Show me a plan practically implemented in the United States that would be not only efficient in spending, because obviously that's a huge problem everybody's acknowledged. Where's the money going in these certain programs? We don't know. So there's efficiency, but there's also effectiveness. How effective would these programs actually be? And my whole argument is that they would not be, because we have, programs that give healthcare to people who need it, elderly, people who don't have financial resources. We have these programs, and most of them are on supplemental private insurance to cover the gaps that is left by these programs. So there's the effective argument. You'd have to, and also cost effective. So you would need efficient, you would need efficacy, comprehensiveness of these plans that cover all the areas that they want to cover, and cost effective. And I do not believe that the government can provide all three of those points.
Okay. Leontes, where can people find you?
I mean, I have a YouTube channel, but I don't really post anything.
Well, when he does get his act together, I will be sure to link him and where you can find him, gang. If you like this topic, thank him, because he's the one that brought this to my attention, and I thought it would be an interesting panel, and we put it together, and it absolutely was. I really appreciate you being here. We'll have you on more often. Killian, go ahead.
Yeah, so none of your 30 data points, which I don't think we had 30, but none of your 30 data points really show that we would get the same results with our government, right? And how they function, they waste. That's my biggest problem with it, right? I don't trust them to actually do a good job in a national healthcare system, and I also don't believe that it won't raise my taxes significantly to pay for it. Because even if you say, well, it's really only going to cost 2.5%, they can raise our taxes, and it doesn't matter. Either way, they're going to raise them, and they're going to raise them in significant amounts. It's just another excuse to grab more taxpayer money. I do agree with you that I do think that low-income families that can't afford health care do need help. The ones that I think would have to meet a certain criteria to get it, but I have no problem with my tax money going towards those people, right, to help them out to get health care that they can't get, especially people that are really
as
trying
long as they
to get
deserve
by.
it.
As long as they deserve it, right? And I think Wick brought up a good point. We have two systems now. The VA, which is atrocious. My father-in-law goes there, and the healthcare there is absolutely terrible. First, right before we start talking about a national healthcare system, and Medicaid, which Medicaid's it is in better shape than the VA, but it's still not in great shape. So, like I said, I'm in favor of individual choice with the best way to go, rather than having a whole national healthcare system. I'm brand new to all this. This is my first panel, so thank you, Wick. I appreciate it.
Of course.
Started a new Twitch channel, YouTube channel. It's 𝕾𝖍𝖎. Also on Twitter. I mostly talk about, or I am going to be talking about men's self-improvement, about goal setting and things like that, and how to be successful in your career and in your relationships. So, and then I'm going to be doing these debate panels as much as I can. So I really appreciate it.
Of course.
And
Go on.
Go ahead.
I was just going to thank you, but finish your shill. Oh, are you done?
I'm going to say to Falser, yeah, I like a good faith debate, and this was a good one. So I appreciate that.
𝕾𝖍𝖎𝖙 gang, check him out. Go give him a follow, right? And I really appreciate you coming on as your first official appearance. You've called in before.
Hopefully I did okay.
No, you did fine. Okay. You did fine. I think you were great, and we'll have you on more often. I think you represent a side that we don't often hear in these spaces. So,
especially with the gun control and anything to do with.
I'll reach out. I'll promise you. I'll reach out.
Yeah.
Okay. Finally, the star of the show, because he was willing to take on 3 at once, 3 men all at the same time, right? And go toe-to-toe with the best of the best that the right has to offer, or that I could find at short notice. Falsers, go ahead.
Well, first I want to just thank the other panelists for, we obviously it was kind of 1v3 and I still felt it was good faith. I didn't feel like you guys were all like talking over me all the time. I know I did a little bit, but I had to try to get in when it's just me. But everybody was super good faith. I really enjoyed the conversation. So I want to thank you all for what I thought was a productive panel. That said, on to closing statements. Um, I've heard Leon and Killian both say, "Hey, our government is too fucked up for this to be viable." And I do not feel that it is sufficient to say our government has problems and then throw our hands up in the name of defeatism and not strive for a better system that gives us better outcomes. It is incumbent upon us to compel our government and our officials and our systems to operate in excellence, irrespective of where they are today. That's how we get improvement. Accepting that things are flawed and not striving for the betterment of those flawed things is a recipe for stagnation. And I don't understand with the right, who are so patriotic, and I think that's great when it's used right, what happened to American exceptionalism? It used to be this good and wonderful thing, and now what it means is we're the only country of similarly developed nations that doesn't have this type of healthcare model. We're the only one. And what do we have to show for it? Well, we have to show what I talked about at the top of it, of double the price of prescription drugs. We have double the GDP spending. We have a lower life expectancy. We have double the rates of chronic disease. We have double the rates of avoidable deaths. Our outcomes are not better. And so I hope that we can get back to a time where American exceptionalism means that when we see we're failing, we don't give up because our system's broken. We put our heads down and say, we're going to be better. And we're going to find pragmatic and meaningful change, because that's what I think real patriotism is.
Ulcers, always a pleasure having you on. Thank you for being willing to come out. Gang, again, Tuesday, tomorrow, 6 p.m. Eastern. Tune in and, kick your feet up. It's on YouTube. And we're going to be having that debate with Destiny, Iona, 𝕼𝖓, and Sunday. Wednesday at 6 p.m. Eastern, we are going to do something different. I am going to be having 4 exceptional women on. 𝕾𝖍𝖎𝖙 will be there. Ice Beans will be there. 𝕾𝖍𝖎𝖙𝖘𝖍𝖔𝖜 and Lil Mole will all be coming on. And they'll be taking your questions, right, about what it is like to be a woman content creator online. What is it like to exist in these male-dominated spaces as a woman? So please come prepped with questions to ask them. I'll have questions myself, and they'll talk about their experiences, and we can have that as a discussion. It will be great, and it should be interesting. So please, 6 p.m. Eastern on Wednesday, come into that. So those are the 2 big things we got coming up. And gang, if you like this content, if you enjoy what I do, I can't do it for free. Please support the program through subs, bits, super chat, and even just following the channel, gang. Sharing it with your friends. All of these are good. Yes, like the video if you're on YouTube. Like and subscribe. If you're on Twitch, follow me if you haven't. Throw some bits and subs my way if you haven't. Really appreciate y'all. We're going to raid out, and we're going to raid out into 𝕾𝖍𝖎𝖙𝖘 today. So give me 1 second. Oh, and if you have things you want me to ask the panel tomorrow, gang, about censorship, free speech, tech, and social media, just DM them to me, and if I can fit them in my will, it should be an interesting discussion tomorrow. But anyway, bye-bye, gang. Bye-bye. Bye-bye. Okay, thanks for being here, gang.